right, good afternoon. So obviously we are filming this. Before we start, are you okay being recorded
Yes.
for this interview?
Mhm.
You give your consent?
I give my consent.
Okay, sounds good. Well, Abigail, I am Chase. I will be your nurse practitioner that will be doing your exam today. So basically I'll just be asking you a number of questions, just trying to review basically all of your systems. So I'll go ahead and get started. So Abigail, what is your full name?
Abigail Jane Love.
Okay, and what is your date of birth?
May 6, 1990.
Okay. And what's your race?
White. Caucasian.
Caucasian. And then what gender do you identify with?
Female.
Okay. Did you come to the clinic today by yourself, or were you accompanied by anyone?
No, just by myself.
Okay. Let's see. And what exactly brought you in today to this visit?
Just my annual.
Okay, just your annual checkup.
Mhm.
All right, perfect. And when was the last time that you had an annual checkup, or when was the last time you saw any provider?
Just like a year ago around this time. I don't know the exact date, but
Gotcha. And what was that visit for?
just like your typical pap smear checkup.
Gotcha.
I don't know.
Yeah. Okay. No, that makes sense. All right. Okay. Let's see. So, what do you have any like past like health problems or health issues? Anything of concern?
I mean, I've had some weird moles, like funky moles, I guess. My mom had melanoma, and so did my grandma on my dad's side. So I've had some taken off. They're precancerous. None of them have been like cancerous, but
Okay.
so,
Okay. Sounds good. I guess could you like just describe those moles for me? Like, were they just like kind of a different shape, or?
yeah, I mean, I've had a ton of moles taken off, but yeah, like different shapes. Sometimes they're like a really dark color, or like the coloration's off.
Gotcha. And did you see a dermatologist? Is that
Yeah.
who
Mhm.
removed those? Okay. Sounds good. And were there any, like with the moles that were removed, were there any abnormal findings?
Yeah, they were precancerous.
Precancerous. Gotcha. Okay. And are you do you continually visit with like do you
Yeah,
see
once
your
a year.
dermatologist once a year? Okay. Excellent. Well, I would definitely continue to see your dermatologist as much as needed. Any other medical problems or issues that you've had in the?
My knees have been like really bugging me. I like to run a lot, and they really hurt when I run. Not so much in the summer, for sure. In the winter, they just ache and hurt so much.
Okay, sounds good. But nothing like that you have been diagnosed with?
No.
Okay. So, and like in regards to that, so mostly it happens when you're running, when you're
I mean,
doing
sometimes
physical.
it hurts just like randomly, but for sure it like kills when I run,
Okay.
and right after I run.
Gotcha. And you said it's in your knees?
Mostly my left knee, but both knees for sure.
Both knees, okay. Any other joints that are affected, would you
Not
say?
super, no, not really.
Okay, gotcha.
Maybe a little, but sometimes in my hands.
Gotcha. Okay. And then how long would you say that pain lasts?
Maybe like a day or two. No, that's like a good amount of time.
Gotcha. Like, is there anything that helps alleviate the pain or the
Just not running.
just not running?
Yeah, I mean, I don't take ibuprofen and stuff. Like, I know I could, but I don't.
Gotcha.
So.
Is there any reason you don't take it?
I don't know. I just kind of forget it.
Oh,
Just
okay.
think about it.
Gotcha. Well, yeah, I mean, that's definitely something you could do to help potentially alleviate some of that pain and perhaps reduce some of the swelling that comes with that. Aside from running, is there anything that makes it worse that you've noticed?
Mm-mm.
Okay. Any other like symptoms associated with it, with the joint pain?
No.
Okay. And then you said the only things that you've tried to perhaps, like, is there anything else that you've tried to reduce that from happening, like the pain? Like, have you tried doing like a lower impact workout or?
Oh, yeah, like if it's a workout or I'm not running, I'm fine. Like,
Gotcha.
I use the elliptical or something.
Okay,
Or
so
even
like-
the stair step or the stair climber is fine.
Okay, gotcha. Yeah. So, yeah, maybe those would be good options, especially if it continues to be aggravated. What would you rate the severity of it? Like, I guess on a scale of 0 to 10.
If it's just like a random day and it hurts, like a 4. If it's running, it's like it's 6 or 7, maybe like a solid 7.
Okay,
Yeah, it's pretty bad.
gotcha.
Sometimes I can't run; it hurts so bad.
Gotcha. Okay. Well, I'm sorry. I'm sorry to hear that. I'm sure that's kind of frustrating, not being able to run as much as you would like. But yeah, I would definitely say maybe just try not to, have as much impact on your knees, and then yeah, you could take the ibuprofen to help reduce swelling and some of the pain as well. Any other medical issues that you've had, like in the past, or that you've been diagnosed with?
No. I do know that my grandma had like heart disease. I know that she had heart disease, and my grandpa, he died from a heart attack. He had like a few heart attacks and then he ended up dying.
Okay, yeah, let's dive deeper into that. So, yeah, I guess just going into your family history. So, I guess we can just go through like all of your grandparents. So your mother's mom. So is she still alive?
No.
Okay, so she passed away, and what did she pass away from?
Alzheimer's? She has a fall.
Okay, she had a fall, and due to Alzheimer's disease. Gotcha. And then what about your mother's father?
That was the heart attack.
Heart attack. Gotcha. And what age was that at?
He was 56.
56. And what age was your grandmother?
I want to say she was 81.
Okay. Gotcha. And then what about your father's dad? Your grandfather?
He died from colon cancer.
Colon cancer. And do you know about what age that was at?
It was 90, 60.
60,
Yeah.
60 years old. Okay. And then what about your father's mom? So your grandma.
She fell as well. Well,
So she passed away as well.
yeah.
Gotcha.
But then she stroked after because they took her off her blood thinners because of her heart issues, and she kept stroking. And she would have been 80 that summer. She was like a month away from her 80th birthday.
She unfortunately passed. You said stroke, and she fell after the stroke.
No, so she fell,
Oh, gotcha.
and then they took her off her blood thinners because she wasn't clotting, and so she stroked.
Gotcha.
Because then she did clot.
Gotcha. Darn it. Yeah, that's unfortunate. And then with your mother, has she had any health related issues?
Just the melanoma.
Okay.
She does have thyroid issues.
Okay. And any other health related issues for your mother?
Mm-mm.
Okay. What about your father? Does he have any health related issues that you know?
He doesn't have anything.
Okay. And then, do you have any siblings?
I just have a little brother.
Okay. And does he have any health related issues?
No.
Okay. Any other significant health related issues in extended family?
No,
Or
but I
whatever?
can think of no.
Okay. Have you had any past surgeries or hospitalizations?
Mm-mm. Not other than having a baby.
Okay,
Mhm.
so having a baby, and were you just there for the delivery?
Mhm.
Gotcha, and then obviously the recovery afterwards.
Mhm.
Okay, and no other surgeries or any other hospitalizations?
Mm-mm.
Okay, have you? Are you up to date on your immunizations?
Mhm.
Okay, did you receive a flu shot this year? You didn't? No
Mm.
flu shot? What about have you had a chance to have like a COVID vaccine? You did have that?
I sure did.
Okay, excellent. Well, that's great. Was there anything that prevented you from getting the flu shot?
I'm really scared of shots.
Gotcha.
And every time I thought about it, I had my little girl with me, no one to watch her. And that wouldn't have gone over well.
Gotcha. That makes sense. But you were able to get the COVID-19. Excellent. Well, yeah, I mean, I'm sure, as you know, flu shots can just be beneficial to help prevent you from getting flu, and it, can help you stay healthier throughout the flu season. So I just recommend that in the future. But I definitely understand how difficult it can be, especially with kids and trying to figure out timing and everything like that. Let's see. What about do you have any like, do you drink alcohol? Like, have you ever drank alcohol? Have you ever consumed? Okay.
Like, ever? Like,
yeah, just
like sips? Like, you're talking,
yeah, just, I mean, just like casually drinking or...
No.
Okay. What about tobacco? Do you consume tobacco? So no tobacco. How about any, like, illicit drug use? No? Okay. Do you take any medications?
Not other than just like a vitamin.
Okay. And what kind of vitamins?
Just like a one a day, like the women's health one.
Gotcha. Okay. Women's health. Do you take anything, like, if you have pain or anything like that?
Sometimes ibuprofen.
And is that just like the standard over the counter, like 200 milligrams? And how many pills do you typically take if
like
you're...
2 or 3.
Gotcha. And is that in regards to anything in particular?
Just like if my knees hurt and I remember, or like have a headache or...
Okay, so headache, knees. That makes sense.
Cramps too.
Cramps. Like the menstrual cramping in particular? Okay, and that's just, I guess, obviously during your period you'd be taking those. Gotcha. And does that help, like, alleviate some of the pain? Excellent. Okay. How would you say your diet is?
Like a normal diet? I don't know.
Normal diet. How often do you eat, like, fast food during the week?
Maybe just like 2 or 3 times. If that.
Okay, 2 or 3. Okay, and then like, how often do you eat, like, red meat and things of that nature? I guess, yeah. Specifically red meat.
Maybe like once a week.
Once a week.
I
Okay.
don't really like cooking.
Okay.
Other than burgers.
Gotcha. So about once a week. How about, like, vegetables? How often would you say you eat vegetables?
Every day, but not very many. Depends on the day. Like, I could have a really heavy vegetable day, and not very heavy vegetable day.
Gotcha. So, like, on a given day, like, once a day, twice a day?
Oh, once a day for sure.
Once a day. Gotcha. Okay, and how about, like, fruits?
Maybe 3 times a week.
3 times a week. Gotcha. Okay. How often, I know you talked about exercising, how often do you exercise typically?
Like 4 or 5 times.
And how long would you say?
Like 45 minutes or so.
Awesome. And what types of exercises do you do typically?
Well, like, I'll do aerobic. Like, I don't run as much in the winter right now because it hurts my knees so much. But if I do run outside, the whole time is just aerobic, just running. But then when I go to the gym in the winter, I start with like 20 minutes aerobic, and then the rest of the time I lift weights and stuff.
Gotcha.
Do the machines.
Okay. Well, that's excellent. Yeah, keep up the good work with that. What about how often do you consume caffeine?
Daily.
Daily?
Lots.
Like, could you a specific number, like 2 to 4 times a day?
Yeah.
Gotcha. And is that coffee, tea, soda? Soda? Gotcha. Okay. Let's see. And do you have any allergies?
Just do amoxicillin.
Amoxicillin. And when, I guess, when did you find out that you had the amoxicillin allergy?
I mean, it was like when I was a baby. I don't know exactly why I took it, but I apparently got hives.
Okay.
That's all I know.
Gotcha. And so as a baby, so you haven't had any reactions since then?
I haven't taken it since then. So I don't know.
Gotcha. Okay. So you got hives. Okay. Well, there you go. Any other allergies that you're aware of? Okay. Let's see. So kind of going on to different topic. So when was like your last menstrual period?
February, end of February.
In February.
I think like the 22nd, maybe.
Gotcha. Okay. And then, are you sexually active?
Mm-hmm.
Okay. Do you use contraception?
Mm-hmm. I have an IUD. I have a copper one. It's the Marina.
Okay, Marina IUD. And are you with like, do you have many partners or?
Just one partner.
Gotcha. Okay. And then you did say you had a child. How many children?
Just one.
Just one? Okay. And does your child have any health issues that you're aware of?
Knock on wood.
Yeah, definitely. Have you ever been diagnosed or are aware of any sexually transmitted diseases?
Mm-hmm.
Yeah. Okay. And then, do you have? You said you just have one partner right now.
Mm-hmm. Yeah, just my husband.
Okay, husband. Let's see. And then, what do you do like for your work, or like, do you work? Do you?
Yeah, I'm a teacher, and I help coach too.
Gotcha. Awesome. Okay, and you said you're married. And what's like your current living situation?
We're in a house. We just bought a house.
Nice. Okay. That's great. Let's see. What sources of like support do you have in your life?
Just lots. My friends, my family, friends at work. I grew up around here, so I have like a really tight knit community.
Okay, awesome. Well, that's great. Any do you have like any like spirituality, like any?
Yeah, my church. My husband and I go to church, just like a neighborhood one.
Awesome. Yeah, that's great. And yeah, that's awesome that you have so much support. I guess what kind of church do you guys go to, or like what is it? Like what religious?
Oh, it's
preference?
Christian.
Christian, gotcha. Okay. And then just like generalized safety. Like, do you wear, like when you're driving, do you always wear a seatbelt?
Mm-hmm.
Okay. Do you ever text and drive or drink and drive?
Mm-hmm.
No. Okay. I know you said you don't drink. Do you own any firearms?
No.
No? Okay. Do you have a pool on your property?
Mm-hmm. No.
Any history of like domestic violence in your life?
No.
Or partner violence, anything like
No.
that? Okay. Do you wear helmets when you ride bikes or things like of that nature? Excellent. Okay. And now we're just gonna kind of basically review all of your body systems. We want to make sure that we're not missing anything. Just to make sure that we touch on everything. So most of these are yes or no questions, but if you do say yes, we can kind of go into more detail if need be.
Okay.
Any recent weight gain?
No.
Any weight loss?
No.
Any fatigue?
No.
Weakness? Fever?
No.
So recently, have you had any eye pain?
No.
Any redness? Loss of vision? Dry or itchy eyes? Double or blur vision? When was your last eye exam?
I actually went in last week.
Last week.
Mm-hmm.
And anything significant?
Mm-mm. They said it all looked good.
Okay.
It was just a free checkup with my work's insurance, so I'd go check them out.
Awesome. Do you wear contacts or glasses or anything?
Mm-hmm.
Okay. Okay, and then moving on to kind of your your head, ears, nose, and throat. Have you noticed any like loss of hearing?
Mm-mm.
Okay. Do you have any nosebleeds?
Mm-mm. No.
Okay. Any loss of smell?
No.
Dryness, like in your nose and throat? Any runny nose currently? Do you ever have bleeding gums?
Mm-mm. I'm really good at flossing.
Awesome.
It was a goal this year.
That's a good goal to have. Keep up the good work. Any sores in your mouth?
No.
Any dryness in your mouth? Hoarseness?
Mm.
Any difficulty swallowing?
Mm.
Okay. So with the cardiovascular, I know you said it sounds like it runs kind of in the family.
Mm-hmm.
Have you personally had any chest pain?
No, I haven't.
Okay. And do you have high blood pressure?
Mm-mm. No.
Do you ever feel like your heart skipping a beat or having any arrhythmias?
No.
Anything like that?
No.
Okay. Do you ever feel like you have shortness of breath?
Mm-mm.
Do you have like a cough?
No.
Have you ever coughed up blood?
Mm-mm.
Have you ever noticed any wheezing? Okay, do you snore at night?
Mm-mm.
Do you have any nausea or vomiting often?
No.
Do you have any pain in your stomach or abdomen?
Mm-mm.
Okay. Constipation?
Mm-mm.
Diarrhea? Blood in your stool? When was your last bowel movement?
Like earlier today.
Okay. And how often would you say you regularly?
Like once a day.
Once a day. Do you ever have heartburn?
No.
Do you have a good appetite?
Mm-hmm.
Okay. Do you ever have pain or burning on like when you urinate?
No.
Do you ever notice any like blood or cloudy urine?
Mm-mm.
Any foul smelling urine?
Mm-mm.
Do you typically have like a regular period?
Mm-hmm. Yeah, super regular.
So just like pretty much every month?
Yeah, really consistent. It's tracked really easy.
Gotcha. And with the IUD, it's
Yeah, the copper one's still been really consistent. When I had the hormonal one, it wasn't. Well, it was consistent, but it was just like really short. It wasn't like normal.
Gotcha.
It was like very normal.
Gotcha. Okay. Let's see. So I know you mentioned kind of your knee pain and stuff like that, but like with muscles, any stiffness in your muscles?
Nope.
Any weakness that you've noticed,
Mm-mm.
specifically with muscles? Any muscle tenderness?
Mm-mm.
Any back pain?
Nope.
You mentioned the joint pain. Any joint swelling?
I guess maybe in my hands a little when they hurt, but
And they hurt every now and then?
yeah.
Okay.
Yeah, sometimes like right now I struggle to take my rings off.
Gotcha. And does anything like set them off? Like, does anything set that off?
It's just like the time of day usually, like in the mornings and the nights.
Okay.
I guess really any time they're just kind of swollen and hurt.
Gotcha. And it does hurt,
Mm-hmm.
and you don't take, or do you take anything?
No, I mean, it
else?
doesn't hurt that bad. It's just uncomfortable.
You're just uncomfortable. Gotcha. Okay. Do you have like full range of motion in your arms and in your legs and knees? Any history of trauma with your body, like muscles or bones?
No.
Okay. Do you bruise easily?
Mm-mm.
Do you have any rashes?
Nope.
Any sensitivity to sun?
Nope.
Any tightness of skin?
No.
Dryness of skin?
Mm-mm.
Itchy?
Nope.
Any hair loss?
Mm-mm.
Any color changes that you've noticed in your hands or feet?
No.
Have you noticed any recent changes in any of your moles?
No.
Okay. And no color changes recently?
Not that I've noticed. No.
Okay. And I know you said you're following up with your dermatologist.
Mm-hmm.
Like with your breasts, have you noticed any lumps or pain?
Mm-mm.
Okay. Do you ever have headaches?
Just randomly.
Random.
Like everyone.
Not consistently. Not.
No.
How often would you say?
Maybe every few weeks.
Okay. And then do you just take ibuprofen or
Yeah, I drink lots of water.
Tylenol?
It's
Gotcha.
usually before I go to bed, so I'm just tired.
Gotcha. Okay. Any dizziness?
Mm.
Have you ever fainted or like any kind?
Mm-mm.
Okay. Any numbness or tingling of your hands?
Nope.
or feet?
No.
Any memory loss?
Mm-mm.
Do you ever wake up sweating at night?
Mm.
Have you ever had like a head injury in the past? Okay. Do you ever have anxiety, like out of the ordinary anxiety?
I don't think I have ordinary now.
Gotcha. Other than just like the normal stresses of the day and
Yeah.
stuff like that. Gotcha. Do you ever? Oh, gotcha. Do you ever lose your temper?
No. I think everyone does, but like not.
Yeah, but where you can't like control it.
Oh no.
Gotcha. Have you noticed any feelings of depression recently?
No.
Difficulty falling asleep?
Nope.
Difficulty staying awake?
Nope.
Do you have any? Have you ever had like a post? Have you ever had a blood transfusion?
No.
Have you ever had? Well, I guess you wouldn't have had a reaction then.
No.
All right. Have you noticed any like swollen? Any of your like swollen like lymph glands or anything like that?
Mm-mm.
One thing I failed to ask. Do you self-examine your breasts regularly?
Mm-hmm.
Have you noticed any excessive thirst recently? Any excessive urination? Any hot or cold intolerance, hot flashes, anything like that?
Mm-hmm.
Any excessive sweating in general?
No. I'm not sweating.
Okay. Any excessive hunger? Like a major increase in appetite?
Mm-mm.
Okay. Do you frequently sneeze?
No.
Have you had like do you ever have hives or like breakouts or anything like that?
No.
Okay. I think that concludes all of our questions. So, thank you for sitting with me and talking about these things.
Yeah, thank you.